everyone, and welcome to a brand new episode of Meet the Masters. I am Sonia Das, your host for the day. Today, we are here at the Open Mind Psychiatry, Counseling and Neuroscience Center in Dubai to meet an exciting personality. He is a British-trained psychiatrist with over 10 years' experience in this field. He has worked with various leading healthcare institutions in UK and UAE. He is also a member of the Royal College of Psychiatrists, UK. Let's welcome to today's episode Dr. Shankar Srinivas. Welcome, Dr. Shankar.
Thank you so much. Thanks for having me on your TV channel.
Always welcome, Doctor. Can you please tell us about Open Mind Psychiatry, Counseling and Neuroscience Center in Dubai and the services you exclusively offer?
Sure. Open Mind Psychiatry, Counseling and Neuroscience Center, it's a Dubai Health Authority and Community Development Authority licensed organization. I'm very excited and pleased to say that this is an exclusive mental health organization. We offer services in the fields of psychiatry, psychology, and also neurosciences. We provide services for children, adolescents, adults, senior citizens, and also couples. We have been in this field, in this organization for the last 1 year. Recently we completed the first anniversary.
Great.
And first of all, I would like to thank everyone and our trusted clients actually. And without them, I think it would not been possible actually to have this journey.
Can you please give our viewers a brief insight into your journey as a doctor in psychiatry so far?
Yeah. Actually, I hail from one of the South Indian states, actually in India. So I completed my MBBS, which is a medical degree in India. So after that, I moved to UK to pursue my postgraduate training.
Okay.
But at that time, to be honest with you, I was not very well aware or not very well informed about the field of psychiatry. Okay. So of course we had some exposure in the medical school as part of it.
Okay.
But I was very open-minded. Because of that, I did a observership in the field of psychiatry in one of the organizations in UK. And I was very much impressed about the way they treat the clients with the mental health issues in UK. Okay. It's a holistic approach, there's a very minimal stigma there, when it comes to reaching out to the services. And it's evidence-based, it's properly scientific and also based on the guidelines in the field of psychiatry. So it really impressed me for me to move ahead with this career. Of course, I had opportunities to pursue in other fields of the medicine also, but I did not look back actually. And fortunately, with God's grace and the support of my family, I was able to really complete the training in the field of psychiatry. So I completed my membership of Royal College of Psychiatrists, and also the Master of Medical Sciences from the University of Leeds. Furthermore, I completed my higher training to become a consultant psychiatrist. Basically, I am an adult psychiatrist with various subspecializations, but also I was exposed to the child and adolescent psychiatry. That's how my journey was in UK. After I moved to UAE actually, so I worked in various organizations to get some exposure and experience as a consultant psychiatrist before setting up this center, to be honest.
All right.
So this was quite a challenging, but I would say it is a fulfilling career for me so far with God's grace.
That's great. You have worked in various top healthcare institutions in both UK and UAE. What made you step into the role of an entrepreneur and lead you into starting Open Mind Psychiatry and Counseling Neuroscience Center here in Dubai?
It's a very interesting journey actually. I would say, I think 2 years ago, while I was working in one of the organizations as a consultant psychiatrist, I was always very much impressed with the holistic approach in the field of psychiatry. That means it's a collaborative and teamwork that matters a lot. Often a lot of my clients and individuals, they have these dilemmas in their minds about psychiatry and psychology, whether they should go for a psychiatrist or a psychologist. I think there's a lot of education that needs to happen actually to have a clear information on this. For me, I think psychiatry and psychology, they might be different branches of the same tree. So I think they should work together to recover a person from the mental health issue.
Right.
So this has always been in the forefront of my mind. So I had a vision in my mind to set up a center. So that's how I became an entrepreneur.
Okay.
So we are a team-based approach, and our vision in this center is having a compassionate healthcare, which is should be innovative and provide some sort of quality-centered approach to the clients.
Right.
And last but not least, it's a teamwork and collaboration with other colleagues. So these are our visions for this organization.
Great. Dr. Shankar, I hail from an Indian background, and without doubt I can say there's a certain stigma around mental health issues and disorders in our culture and around us.
Yeah.
Yes, we are fortunate to live in a country like UAE that gives importance to mental health, but what is your opinion on this?
Definitely, when it comes to India, I think let's start by discussing about this issue. It's a very important, pertinent and burning issue actually, the social stigma and discrimination. Social stigma is something, the way we feel about a person going through a mental illness, and discrimination is something, the way we behave towards that person.
Yeah.
So both social stigma and discrimination has been a huge issue in the field of mental health, and that is stopping a lot of people to take a right help. I would say right help. They're taking help, but I think may not be a right help.
Yeah.
India has a population of over 1 billion, and as per the World Health Organization statistics, there are 1 in 6 or 1 in 5 people who go through some kind of mental health issue. It could be a normal stress or a depression or anxiety. But very, I think, sorry to hear this, that only 10 to 12% of the population take the right help. Yeah. So that means, rest of all the individuals are suffering. I think it could be due to lack of education.
Yep.
Now coming to United Arab Emirates, thanks to the rulers of this country and also the various organizations like Dubai Health Authority, Community Development Authority, I think we are really very forward in the development of the services here. There are many organizations dedicated to mental health here.
Yeah.
Of course, it's a lot better and very developed compared to before. I was told that back in few years before, if anybody had an urgent mental health issue, they had to really travel abroad to seek help.
Okay.
But nowadays, we have excellent services both in government and private organizations, and of course, we are embracing various scientific approaches.
Right.
We are able to really observe or implement the various scientific approaches in the field of mental health also. Could be a therapy or medications and so on and so forth.
Right.
And I think, it is very positive, I would say, but there is a lot of work that needs to be done.
Definitely.
Even in this part of the world.
Definitely. In the olden days, the term psychiatry or any mental health related issues were associated with insanity. Nowadays, there are many options available to help us with our mental health, for example, therapists. Do you think people make use of these options and give mental health the priority that it needs to be given?
Nowadays, I think the people are very well informed. I think thanks to the media or the social media, and I think you're all part of that actually.
Yeah.
So for spreading this awareness information among the society, various members of the society. But still, I think individuals are still suffering among themselves within the family, when it comes to the stigma related to this mental health. Well, coming to the various approaches, we have options like, medication management that is usually tackled by a psychiatrist. A psychiatrist is a medical doctor. Likewise, we have therapies. I would say, and I firmly believe in this, that therapy really works.
Okay.
When it comes to the scientific approach done by a right person, integrated with a psychiatric collaboration or a lifestyle management with the support of the family members, definitely this helps.
Right.
People are really coming forward to take the help in regards to seeking the help for the therapy.
Right.
Therapy is not simply lying on the couch or simply talking to somebody. It is a scientific approach done by experts who have dedicated their lives into these fields.
Right.
So I definitely feel that yes, therapy works, and given a chance, I think definitely there will be a recovery-based approach that can be taken by centers like us.
I believe depression is a mental health condition, and this word has been making rounds even in the media due to the number of lives it has claimed. Personally, I know people who has underwent mild depression and at the same time, I do know people who do not believe in depression and end up saying it's just laziness of some sort. Dr. Shankar, can you please elaborate about depression and how to differentiate it from our common stress-related behaviors or reactions, if that is the right term for it?
When it comes to this, I think, may it be somebody who is completely going through a severe stress, or it could be somebody who is stuck in a traffic jam, or somebody having a serious issues at the workplace or a relationship issues. These all can trigger stress.
Right.
Some amount of stress is very important for us to motivate ourselves and to accept the challenges and to move forward in our life.
Definitely.
That's how we also understand the coping mechanisms, how to deal with the stress. But stress, when it becomes very severe, like if it is a continuous, without any support from the family or the professionals, that can lead to any mental health issue. When it comes to depression is something wherein there is a certain period of symptoms, wherein sadness, continuous sadness, or low mood on a daily basis, and the individual would not be able to enjoy the things which he or she would have been enjoying perfectly before. Likewise, they isolate themselves from the society, from the friends, from the family. They could be seeing some changes. They or the family members could be seeing some changes in the sleep patterns. Could be excessive sleeping or very reduced amount of sleep hours. Or eating patterns. In the severe stages, it could lead to some scary situations wherein they think and plan about committing suicide. So these are the various symptoms of the signs which one can really differentiate from a normal stress. So the take-home message is stress should not be left as it is. It should be acted on. It could be a simple stress management technique. Could be a simple walking on a daily basis, or seek professionals for stress management options, so on and so forth. So depression is something wherein we know from the statistics that 1 in 5 people have some sort of common mental health problems, mainly a depression. So depression has got wonderful treatments. This is a treatable condition. An individual can recover from depression. So I think individuals or the society needs to know about this. There's excellent treatment options. Could be medications or the therapy. But the first thing is to talk to someone, friend or a family or a colleague, that they are going through these issues. And seeking help from the professionals who are experts in this area.
So there is something, is there a term called as mild depression? Or is it just depression alone?
It's a wonderful question. Actually, it's a depression, again, it's loosely used terminology in the society, as you know. So yes, there are gradations in the depressions like mild, moderate and severe. And if it becomes severe, and people can sometimes lose touch with the reality, that means they can have certain symptoms and signs like paranoia, like feeling suspicious about the people around, In a very severe case, it can lead to hallucinations, like losing touch with the reality, that imagining that somebody is talking to them, so on and so forth.
Schizophrenia?
Yeah, I think even schizophrenia is one of the psychotic conditions where you see all these symptoms. But again, even with depression in extremely severe condition, extreme severe depression, you can see some of these symptoms. Absolutely. That's the reason why the sooner the better. If you want to really recover from the depression or any mental health issue, the sooner you take help from the professionals who are experts in this area, the better it is for you to seek, get recovered from these conditions.
And how long do you think, a usual state, like how long do you think the treatment should be there for depression or a person to completely recover from this?
Well, when it comes to a proper clinical depression or a major depression, is what we assume to be talking about now. Yeah, it varies from individual to individual. It's not a one size for everyone, you know. But as roughly from the guidelines perspective, somebody who doesn't have a previous history of depression and just started having the first episode of depression, we say about roughly 6 months to 12 months of treatment with the medications.
Okay.
Right. The way we work in Open Mind Center here is, you know, soon after this particular individual is out of the acute depression, we usually refer the client to the psychologist.
Okay.
Yeah. A clinical psychologist, somebody who does talking therapy, behavioral management, you know, changes in their thought process,
right,
so on and so forth. So when the therapist works with this client to motivate this individual and support this individual on a regular basis, there's a very high chances that, you know, he will be able to gradually come out of the medication at a certain stage.
Right.
Yeah, roughly we say 6 months to 12 months. You know, if it is a very simple depression without any complexity, he'll be able to come out of the medication by then. You know.
Okay.
So we do a team approach in this center with close collaborations, having the regular meetings about the updates about the clients, so on and so forth.
Right.
Yeah, this is how the recovery happens, and recovery is something which is holistic in nature. That means it's a combination of the things that works. So it's medications, therapy, and also I think the lifestyle changes plays a huge role.
Okay.
Yeah. So we advise the clients to be better in dealing with the stress, or encouraging the family to be involved,
right,
or requesting the family to be more supportive to the individual if that is a triggering factor or maintaining factor. You know?
Right.
So these are the various aspects, you know, combined together. I think there's a very high hope for recovering from the depression.
Great. Dr. Shankar, what are the common psychological issues seen around this region?
I think according to the recent statistics done by the Institute of Health Metrics, global disease burden, the conditions like anxiety disorders, substance dependence, and clinical depression, and adjustment disorders, which I see very commonly in clinical practice. These are the main conditions that prevalent here in this area. And also from the clinical practice side of things, I also see a lot of individuals coming through the personality related aspects. You know, personality is something which is formed roughly by age of 16 to 18, 19 years. It's based on our childhood development, the stress or trauma we were exposed to, the
right,
or parenting styles, so on and so forth.
Something like trust issues, something similar?
Absolutely,
or?
absolutely.
Okay.
Trust issues, you know, having issues related to rejection. You know.
Oh, okay.
This could lead to a lot of burden on an individual when it comes to relationship forming or interpersonal relationships with the colleagues or the friends or the family or the spouses, so on and so forth. I think these are also some of the common conditions which I see in my practice.
You had actually spoken about, we had actually spoken about the couples therapy.
Yes.
So
Absolutely.
what about those in this region?
Yeah, I think I would say is a significant number of individuals going through these issues, I would say. That's the reason why as part of our long-term vision or short or long-term vision, so we have a dedicated marital or couple therapist in our region, both Arabic and also native English speaking individual here.
Okay.
So couple issues, yes, it's been quite a significant rate, I would say. And apart from couple, one of the other things which I find very commonly is adjustment disorder. Adjustment disorder is something which is it could be a simple stress related to life events. You know?
Okay.
Life events are something which are not under our control. You know,
Yeah.
so it could be death of a family member, near to us, or it could be stress related to the work or finances. And also one of the, as part of the World Mental Health Day on October 10th, I think the experts say that stress related to the finances, stress related to the domestic issues, the family related, relationship related issues have been a high rise, you know, in this part of the world. I would say I think a significant impact has come from current pandemic, what we are going through.
Yeah.
COVID pandemic, and that has led to a lot of issues related to relationship and also stress, because it is something which is we are not aware of how to deal with.
Right.
The individuals are not aware of how to deal with few people around themselves, in the family.
Yeah.
All of a sudden they have to really stay at home.
Yeah.
There is a boundary management issue. There is interpersonal relationship issues, so on and so forth. I would say this is also one of the recent trend actually because of the COVID.
Right. Does genetic and lifestyle play a role in certain disorders or conditions found commonly?
So when it comes to the causes of these conditions, I would say it's a multifactorial inheritance. It is not only the genetic. Yes, genetic plays a huge and significant role. We all inherit genes from our parents and ancestors,
Yeah.
and which dictates how the brain is formed, so on and so forth. Because of that reason, definitely the genetic risk gene will be passed on to the subsequent generations.
Right.
That plays a role actually in the causation of these conditions. But I feel actually that itself will not decide whether a person is going to suffer from this condition or not. Of course, there are certain chronic and also very serious mental health issues that could be directly inherited.
Okay.
But in general, when you talk about the common mental health issues, genetic risk plays a role, but it is not a deciding factor.
Right. Okay.
It's both gene and environmental interference with each other.
Okay.
What we say again, it's a biopsychosocial causes. That is, biological is a medical causes, wherein we have genetics, we have hormonal imbalance, chemical imbalance in the brain. Then psychological causes is something which we get it through our personality development, and also some certain traumas or any stress that happen in the childhood that leads to changes in our thought patterns. Those are the psychological causes. And finally, the lifestyle related causes are also important. That means unhealthy lifestyles like maybe sleep hygiene issues, eating habits, severe stress, burnout situation, but you are not working on that.
Right.
So these are all the lifestyle related or ongoing stress related to your finances or job related, but you are not able to work on it.
Right.
These are the three different areas, like it's a medical, psychological, and environmental.
Right.
So it's a multifactorial causes. It's not one cause that dictates whether a person will have a mental health issue or not.
Right. And if it's just lifestyle, say they did not inherit or did not go through any of the medical conditions or any traumas like that in the childhood, and if it's just the lifestyle, can it still be quite can it impact a lot of or trigger health conditions, mental health issues?
Definitely, the lifestyle related stress or the issues are the immediate triggering factors to bring out the condition.
Okay.
A person, for example, has genetic risk, a person has some psychological factors from the childhood are like that, but he might be living healthy throughout maybe say 30 years of his life like that. But unfortunately, there is some life event in his life, and there is a severe stress going around. Yes, I think that can trigger the issue.
Okay.
Yeah. So the lifestyle modification is very, very important to start with, so that we can nip it in the bud itself.
Right.
So that the triggering factors would not be going forward.
Oh, what about eating healthy? I mean, how does eating or moving to a plant-based diet of any sort help in reducing these issues?
So when it comes to eating healthy, yes, definitely that will reduce the risk.
Okay.
We can only say that the risks will go down when it comes to the healthy eating and also healthy sleeping habits.
Yeah.
That's the reason why we are very holistic in our organization. We have a functional nutritionalist expert here.
Okay.
So that the clients can take help in reaching out if they see that they are not able to control their eating habits.
Right.
We have a concept called as emotional eating or stress eating, wherein the stress itself can lead to excessive eating habits, excessive eating.
Right.
That's like a vicious cycle. They are using a wrong coping mechanisms to deal with the stress.
Right.
Yeah. Likewise, the substance dependence, could be smoking or alcohol or whatever it is.
Yeah.
That itself, could also really be a coping mechanism, which is not a healthy coping mechanism.
Right.
So these are all the eating. Yes, definitely it impacts the recovery of the person. Yeah, when he wants to completely recover from the condition, he wants to come out of the medication, exercise and healthy eating plays a huge role.
Definitely. Dr. Shankar, you have extensive experience in the complex medication management related to the field of psychiatry.
Yeah.
Kindly tell us, what does the term medication management mean and how does it help?
Medication management is something which is done by psychiatrists in our field. It is first of all to assess a client to see what exactly is the diagnosis of this individual, whether this client requires medications to improve the chemical balance in the brain.
Right.
This is done at outpatient level in our organization, wherein the clients are first of all, after having a diagnosis, discuss about the role of medications in their case. Okay. When it comes to medications, I think you might have heard there is a lot of social stigma attached to it.
Definitely, yeah.
Being in this field for quite a number of years, I feel that not every medication in the field of psychiatry are dangerous. They are very safe and they have been extensively researched before it is reached to the society or individuals.
Right.
I think that we have a mixed opinions on that, and discrimination, social stigma is playing a huge role.
Yeah.
So when we educate the client about what is the role of the medication in this case, whether he's just taking the medications to increase some of the chemicals in the brain, just like we take thyroid to increase the thyroid levels, we use some of the medications used for diabetes, to improve our glucose levels. In the same way, whether the client is using the medications for that purpose, or it is a short-term medications to improve their sleep. Yeah. So this education needs to start from day one of their appointment with the psychiatrist.
Right.
So I think by doing so, the education improves their ability to take the things more seriously and also stick to the compliance with the medication.
Right.
Yeah. So medication management starts with education about the medications, the way the medications work in the body, and also what are the various side effects that they can expect. Okay. Again, I say that not every side effect that's written in the literature or the common forums or Google, the medications will give that to the client. Each individual react to the medications very differently.
Right.
Yeah. By and large, most of the side effects, I would say, it will go away within few weeks. It can be within a week. The client can be completely fine without any side effects. So that improves the compliance. And some clients are very sensitive to the medication.
Right.
Not only these medications, even the medications used for other conditions also
Right.
can be very sensitive. So I think it takes a little bit longer time.
Right.
So once they know about these side effects and how often they have to take the medication, and also what are the expected things that they should really reach us to, if there are any concerns. All this really matters when it comes to the medication management. So this is done at the outpatient level.
Okay.
We start the medications, and also we usually see the clients on a monthly basis to discuss about any changes that needs to be done with the medication doses.
Right.
Sometimes too high doses or too low doses.
Okay.
Or addition or deletion of the medication from the regime. All these are discussed in the outpatient treatment.
All right. Following your line of thought, Dr. Shankar, you had said about the thyroid medication,
Yeah.
but wherein there is again this saying that thyroid medication is for your life. Like it is, you can never stop it. It is until you die, you have to keep taking it. Otherwise, it messes up your hormones.
Yeah.
So is it the same way for these medications as well?
See, I never tell to my clients that it's a lifelong treatment.
Okay.
Yeah, so I have my own perception about that, having treated few conditions and who successfully recovered and stopped the medications without any lapse.
Right.
But again, can we indefinitely say that they may not need the medication in the future? It's difficult.
Right.
Yeah, that is the reason why these conditions are disorders. They are not diseases.
Right.
That means there could be another episode of depression or anxiety because of some life events or anything, some brain chemistry, and they may need medication in the future. Yeah.
Okay.
But we wouldn't say lifelong. As I mentioned to you, there is a duration of the period of the medication that needs to be given, and combined with the other approaches like behavioral or therapy-related approaches, and we do that, there's a high chance that they can come out of it.
Okay.
Yeah. And they have to put effort, self-efforts to maintain that.
Right.
If not, I think there is a chance of relapse again. Yeah.
Okay.
But nothing to scare about, but there are some conditions which requires chronic medication management.
Right.
Yeah. Again, this depends on the various factors. You know, it's not, we cannot really put a black and white guideline onto that. It depends on the past history of the client,
Right.
the family history, or any other medical problems he is going through, so on and so forth. But attempt has to be made by the specialist or the consultant about discussing with the clients about how many more months or how many years he has to take, so that he is very well informed.
Great. Yeah.
So unless we discuss that, we will not be able to attempt to reduce the medication or stop it. Of course, with the close monitoring by the family and the professionals.
Right.
And sorry about regarding the thyroid, I think I'm not an expert in this area, but I think I will leave that to my colleague endocrinologist to take care of that. But again, I saw a few clients who usually tell me about the thyroid medications. I think there are clients who are out of the thyroid medications after a few years.
Okay.
Yeah. So maybe the thyroid is better, the issue is a little bit better, or they may not need that medication anymore.
More, yeah. Dr. Shankar, stress can affect one's mental health deeply is a commonly heard phrase.
Yeah.
Is it true? If so, how does stress play a role in creating psychological issues in an individual, and what are the best ways from your perspective to avoid such a situation?
Yeah, as I mentioned to you, stress is definitely a factor which can trigger mental health issues.
Right.
This stress can start right from the very early age, right from when we are children, you know.
Okay.
So each and everything matters when it comes to the parenting style, so on and so forth. Of course, I think not every minute or mild stress would really impact or give rise to the mental health issues. But combined together, or any major traumas or severe stresses can definitely impact or remain as some sort of a blueprint or some sort of belief systems in the minds of the individuals.
Right.
That was exactly what I was saying about the psychological factors. You know, this starts right from the childhood. You know?
Okay.
Coming to how to avoid this stress. It depends on what stress we are talking about. Like for example, some individuals with anxiety disorders, they are not very great at multitasking. So they can prevent this sort of stress, you know, by working on making a list about their works, you know, or having a support from the family or the colleague, you know, if they are going through any stress, so that you know they don't really become very deepened into their stress or the anxiety. So they can really cut in the bud itself.
Right.
And lifestyle changes like regular exercising. We have a scientific research evidence that regular exercise can improve the chemical balance in the brain. Like, you know, it improves certain chemicals in the front part of the brain. So by doing that, even before they encounter any issues related to the mental health, by doing that as a lifestyle modification, so they can really prevent this sort of issues in the future. You know.
Okay.
And we spoke about the healthy eating. You know, sometimes high expressed emotions, you know, within the family or within the relationships, then can lead to the issues related to severe stress.
Right.
So those are the certain things, you know, family education has to be done by the professionals involved in this area, so that this can be avoided in future.
So family support is one of the main core pillars, I believe.
Family involvement, family support, you know. When it comes to the chronic enduring mental health, that means chronic conditions like, you know, you spoke about schizophrenia, bipolar affective disorder, or a recurrent depression which has been there throughout their life, you know, or somebody going through certain conditions like obsessive compulsive disorder, wherein they are very repetitive in doing the things. You know.
Right.
It could be certain rituals or certain thought processes. For this, the family involvement is, I think, significant. You know, it plays a huge role when it comes to recovery of the condition.
Right.
Again, lifestyle changes as we spoke about. So these are the certain things actually we can prevent this condition.
I think OCD is something that I think in generally we all have very minute OCD things that we don't tend to see it as OCD, but another person can definitely view it as a repetitive behavior or a compulsive behavior on doing it the same way that they want.
Yeah.
So isn't it something common then?
A lot of individuals in society, even my clients sometimes ask me this question, OCD is different from OC behaviors or OC traits.
Right. Okay.
OC behaviors we all have, like what you said.
Okay.
It's very common. We see that it comes right from the engage. But we manage it. It will not impact your life. So you will not be spending hours and hours of your time, or you will not be really spending anything that is quite debilitating to your health. Like heavy washing, use of the disinfectants or the sanitizers to the extent that it leads to dermatological issues.
Right.
So those fall into more of OCD, obsessive compulsive disorder,
right,
that is affecting your lives. But something which is OC behaviors that comes from your childhood, wherein you do the things but you forget about it, doesn't really affect your life or your occupation or the studies, those are quite commonly seen.
Right.
One has to really differentiate between these two things. We see this OC behaviors or this compensatory behavior. That means people tend to have some sort of relaxation from the anxiety by doing so.
Right. Yeah.
But it will not really impact them to a significant level.
Right.
It's very commonly seen even people with some form of depression or normal anxiety, they do the things repeatedly. Like for example, somebody who is very anxious about their safety, they tend to repeatedly check the doors.
Yeah.
But after 2 or 3 times, they are reassured, and they go to the sleep.
Yeah.
That we don't class that as a severe disorder.
Right. Right. Okay.
So this is a main difference between that.
So are panic attacks a part of the anxiety disorders, or does it cover
Absolutely.
almost?
Panic attacks or panic disorder, it's in the same spectrum of the anxiety disorders.
Right.
Just like depression or the mood disorders, anxiety is a completely different spectrum again. This spectrum can be from minute anxiety to as severe as OCD or a panic disorder. So it all comes under the same spectrum. That is the reason why in clinical practice we see that people who start with a minute anxiety or minimal anxiety, they can at some point have panic attacks also.
Right.
Yeah, that's a possibility.
Right.
Because it's in the same spectrum.
Right. Dr. Shankar, you treat a wide range of mental health issues, starting from stress reaction to pregnancy-related mental health issues.
Yeah.
My question is there an age scale for the mental health issues to surface? For example, traumas at a very young age, as you said, may cause certain mental health issues in the human psyche that can only start to take effect later on or surface later on in life. So in that case, what would you say? Is there an age scale? Because even you use the term from a very young age.
Yeah. I think that when it comes to the mental health issues, core mental health issues, what will be stress or anxiety or OCD, I don't think there is any age scale for that. Okay. It can start at very young age also. But maybe later, like for example, after 8 or 10 years of age, I think it surfaces significantly, like in the form of panic attacks, the form of behavioral issues. But not all behaviors, I think we need to understand here that in the childhood especially, not all behaviors can be classed under mental health.
Okay.
So some behaviors could be quite common. It could be a stress management technique for that kid. So we cannot classify every behavioral issue we see in the childhood as a mental health issue. Of course, definitely it needs to be evaluated by an expert before we say that it is not a mental health issue or not.
Right.
So it can start as early as a very young age, and it can continue, and even in the senior citizens, in the elderly population, like we have the memory issues or dementia, that can be commonly seen in elderly population. So answer to your question, yes, there is no particular age. It can start from very early age.
The pregnancy-related mental health issues, which actually surprised me, because the postpartum depression, or where I heard very few people speak about it. Again, there's a certain stigma around it, that it is not possible for especially mothers who have just delivered to have such issues. At the same time, I've heard situations where the mothers cannot even bear to go next to their child or feed the child, and at the same time they're feeling regret or guilt and they're unable to approach the kid even. So is it, I mean, how do you even treat this?
Yes. It's very challenging, and also I think it's very concerning actually when it comes to this area of the psychiatry or the psychology. Postnatal depression is common, but one has to differentiate between postnatal blues and postnatal depression.
Right.
Again, it is like not all stress-related issues or depression. So we spoke about this, right? In the same way, not every postnatal blue symptom would be postnatal depression. Postnatal blue is something wherein, because delivery is a very complex process involving various hormonal systems and the chemical mechanisms in the brain. So definitely psychologically it is very exhausting for the mother to give a childbirth. Because of that reason, I think it is very common for mother to have some sort of sadness. Especially it's very common in those who have got a past history of depression or a past history of mental health issues before delivery. They can have this postnatal blues, but usually it should go away after a few weeks. But what happens when it continues and becomes more severe, involving the risks related to themselves and also the newborn, and we say that it's a mode of going towards a postnatal depression, and that will impact the bonding of the mother with the child. And as you rightly said, yes, because of the risks related to the condition, maybe the mother is having some sort of thoughts related to self-harming, and sometimes unfortunately maybe some thoughts related to harming the baby or something like that. Because of that, it's difficult for mother to go through that process further. That's the reason why we have a dedicated teams or the units back in UK. I used to see that it's called as mother and baby unit. Right, wherein the mothers and babies are nursed in completely a different environment. Of course, mother will have an opportunity to see the baby and try to reintegrate back into the process as soon as possible with the treatments. Yes, but it is possible. Actually, I have seen these conditions, postnatal depression, and also unfortunately we have a term called as postnatal psychosis also, wherein the mothers lose the touch with reality, they have paranoia or hallucinations, so on and so forth. But there are excellent treatments for that, and it's a very sensitive time to treat a mother in this, because the mother might be feeding the baby, and we should be very conscious about the right medications to be used in that situation.
But what causes the postnatal depression or the blues even? I mean, I understand that the hormones are fluctuating and coming back to, the hormones would be coming back to the normal state. That can be one of the reasons. But other than that, what would trigger such an issue?
My experience is actually severe stress during the pregnancy time. Somebody having severe stress during pregnancy time, it could be any form of stress. It could be related to the relationship or the family or any stress a pregnant woman might have gone through. That increases the risks of developing the postnatal depression. And somebody who has already got an existing genetic risk or previous history of depression, but they might have stopped the medications because of the pregnancy, and the risk is a little bit high to get depression postnatally. And the stress related to the childbirth could be somebody who's in labor process for a long time, psychologically very exhausting. Somebody having ongoing hormonal issues, impacting the symptoms of depression. So this is again a multifactorial, so various factors that leads to one having depression postnatally.
What are the AI developments in the field of psychiatry, and how is AI integrated into Open Mind Psychiatry Counseling and Neuroscience Center treatments?
Well, artificial intelligence, actually, I think it has started to come into our field also. I think I can see that, the speech recognition systems actually that some softwares are using. It could be the management or the documentation related processes. And in Open Minds, I think recently we had a meeting with one of the digital marketing companies actually, wherein we can use an app wherein it can communicate with the clients, without any delay after they reach our center.
Okay.
So it's like, an automatic system where they will be able to know whether they're looking for a psychiatrist or a psychologist, or if it is psychologist, what age group, and it's all programmed in the app itself. So that is one of the developments in the artificial intelligence, I think. So this is one of the things which we are planning to really bring to the Open Minds. And of course, needless to say that I usually advise on the certain apps for the sleep management, so meditation, exercising, all this, and which is also part of the artificial intelligence. Yeah, it's still in the early stages in our field, I feel, when compared to the other branches of the medicine. But definitely we are proactively looking forward to use these techniques in the future.
Please throw some light about the future plans of Open Mind Psychiatry Counseling and Neuroscience Center.
Yeah. Currently, we have experts, and thanks to all my team members on this occasion, actually, we have an excellent and wonderful team working together for the best interests of the clients in a collaborative manner. We have myself as a consultant psychiatrist, and very soon we're going to see a child psychiatrist also in the center.
Okay.
So we already got somebody who have agreed to really provide services to our center. That's one of the things, and our vision is to add a neurologist, because ours is a neuroscience center. Neurologist both for adults and also children, child neurologist, so that we work together with the neurologists, so that they have the clients or the parents have all the services under one roof.
Right.
We have child psychologists, we have a psychologist dedicated for trauma. More recently, we recruited somebody, and she's an expert in the EMDR, which is an advanced trauma technique actually. It is done through eye movements. Actually, she's an expert in this area, and she's Arabic speaking, and we have team members dedicated to all these approaches. The future plans would be to recruit a neurologist, and also any allied services related to that. And as part of that neurosciences, we also try to develop it in the child area, also child psychology, and also anything related to the child development. So let's see how it goes.
Great. Before we move on to the final question, I think a quick differentiation would be between psychiatrist, the term psychiatrist and a psychologist, because that kept even confusing me as well.
Sure, yeah. The psychiatrist actually is a medical doctor.
Okay.
He has done a medical degree like any other medical doctors you see in the clinics or hospitals. But he's an expert in the field of the mental health. So he has taken a route of mental health specialty. So he actually, for common man's understanding, a psychiatrist is a medical doctor. A psychiatrist can diagnose, psychiatrist can investigate further through the blood test or the ECG to do the baseline checking, or refer to some other medical specialist, if there are any underlying medical issues. And last thing, which is very important differentiation, is a psychiatrist can prescribe medications. A psychologist, I think most of the psychologists, what I encountered in my career so far, they are not medical doctors. But they are experts in this field. They do talking therapies. Talking therapies could be counseling, what we say in a common man language. But the psychologists, both clinical and counseling psychologists, they do a scientific approach, scientific-based therapy or psychological treatments. That's the main difference. I think most of the psychologists, they are not able to prescribe the medications because they are not medically trained. This is the main difference between psychiatrists and psychologists.
Got it. Moving on to a final question. What is the one most important thing you would like our viewers, especially the adults among them, to keep in mind?
On this occasion, actually, we recently had a World Mental Health Day also on October 10th. Our message to individuals are to beat the stigma related to the mental health. the shame and the fear related to the reaching out to a psychiatrist or a psychologist or a counselor has to be reduced. By beating this shame and the fear, one can really take a step forward to reach out to professionals or experts. I think that is a very important thing that needs to happen. The second thing is about not only the individual, I think the family members or the friends or colleagues who are seeing some differences in their behaviors of the individuals. I think they should be less judgmental, less stigmatic, and encouraging this individual to take the help and support them in the process. And last but not least, I think lifestyle management or the stress is very, very important, as I mentioned. And though we have experts, psychiatrists and psychologists or the nutritionists, I think unless the individual has got that effort-oriented approach that they have to put efforts to get better, I think it's very, very difficult for the professionals also to help them.
Right.
So I think the first thing, I think the help should start from yourself.
Right.
That's what I say.
I think that's a really great message, Doctor.
Thank you. Thank you so much for that.
So with this, Doctor, it's time to wind up the show. So thank you so much. Thank you so much for taking time off from your busy schedule. I understand you must be you must be having a really packed schedule. And yes, thank you so much for being here.
It's mine, and thank you so much to the entire team actually in your channel. I wish you all the best for that.
Thank you so much, Doctor. Looking forward to seeing you in other interviews as well.
Thank you so much.